Hello, hi. This is Dr. Karen Perez with another video, and this time we'll be talking about how to develop or how to write a scientific question, such as the Peacock question. So let's get into it. So the PICOT question is a mnemonic designed to systematically create a clinical research question. This is either used when they're doing an evidence-based practice or project, and is also used in a research project. So the P stands for patient, the population, or the problem. And this is the who or the what is the patient, what is the population or the problem in the question. And then the I is the intervention. What is the intervention? What action, treatment should be considered? The C, which is a comparison or the control, is what other intervention is being used or should be considered. When doing an evidence-based practice, you will see it in the format of what is currently being used and what is being comparing to. The new intervention that you're thinking about and what the organization is currently using. As it relates to the outcome, what is the desired or expected outcome or objective? And then the time frame. So sometimes in a PICOT question, you may not see a C, which is a comparison, you may not see the T. So now, if you're in a program, please refer to your university or your program rubric in what is expected. Because if you're doing the DNP, I know for particularly, they're going to want all aspect of the PICOT question included in it. So one thing I want to say, before formulating your question, it will be best if you did a needs assessment first, especially for my DNP students. So most programs have coursework inside there where you need to do a needs assessment of the organization. Doing a needs assessment before formulating a PICOT question is vital because you don't want to start writing a PICOT question when you don't actually know what the problem is. So it is best to have done a need assessment or do some research first before formulating a question. So let's look at some examples. So for the P, an example could be adult patient recovering from thyroid surgery, or patients with type 2 diabetes, or patient 15 years old, or residents living in Miami-Dade, or nursing students with ADHD. So these are some examples of either the population or the patient or the problem. The intervention, what are you going to use? What is your intervention? And this is particularly interesting point. Because what I notice most of the time with the student, they have this idea in their head or what they think may work without proper evidence. So that's why it's called evidence-based practice. And that's why some research is needed before formulating this question. So even though it's a scientific question, it's not just asking out of the blue. It is systematically formulated based on research that you've read up on already. And that's how you're formulating this question. So when we talk about intervention, say for example, you're working in an infusion suite, infusing chemo. And instead of giving pharmacological therapy to reduce nausea and vomiting, you want to try aromatherapy, or you may want to try ginger tea. So that's an intervention, something that is not being currently used in that setting. Or what about a diabetic self-management tool that you can use that will decrease blood glucose level? Or the PHQ-9 tool that can be used to diagnose depression, or a residency program. With the intervention, because it is evidence-based, you cannot create your own intervention. You cannot say, oh, this worked at that hospital, so I'm going to use it. It must be rooted and grounded in evidence. So it can be a tool that is already created and tested and show that it is valid and reliable, like a diabetic self-management tool from ADA, or the PHQ-9 scale that is used to identify or assess for depression. And there's so many other tools out there that have been shown that it's reliable and valid. Now, if we're talking about a residency program, we have many organizations and many research studies done. So if you're not talking about a tool that was already created by a well-known organization like ADA, the American Diabetes Association, then you're talking about research that have been conducted. And it cannot be that you find one article that shows that residency program works. You have to actually find more than one article that supports the implementation of a residency program. All right, so this part is pretty crucial. As a DNP student, if you're going to test if something works without having the evidence to support it, you're actually doing research. And there's a very thin line in using these words, research. Remember, you're conducting an evidence-based project, and research is different. So what you're looking for is tools or research study that have been done to show that this process actually works. All right, so that's your intervention. Your comparison, you could say that you're comparing it to their current practice. Like, what is the benefit of using a diabetic self-management tool versus current practice? Or I have current practice twice, but in comparison to no residency program, or in comparison to nursing orientation. So remember that comparison can be, in some cases, although I've not seen it in a DNP program, but when a project or evidence-based project has been implemented, like in an institution, sometimes they don't have a comparison or a control. Outcome or objective. No, this is important. What is it that you want to see? What is it you expect to happen? Because you have done the research. So what do you expect to happen? Do you expect to see a reduction in the use of pharmacological treatment for nausea and vomiting because you're using aromatherapy? Or are you looking to see an increase in retention rate, increase of nurses? Or are you looking to see a decrease in blood glucose? Or are you looking to see early detection of depression because you're using the PHQ-9 scale? What outcome are you expecting to see? And then the time frame. So most of the time when you reach the implementation stage, it's 8 weeks, or you're going to have it 8 weeks or 10 weeks or 16 weeks, depending on your program. And again, I'm going to show you an example of where sometimes time frames are not used in a PICOT question, okay? So there are different types of questions. There's a treatment and intervention, there's a diagnosis and assessment, there's a prognosis, there's a causation or etiology, and then you have the meaning or progress. So for treatment and intervention, this is used to determine treatment that results in best outcome. All right, or an intervention that results in best outcome. For the diagnosis and assessment, this is used to determine the best tool or test that is more accurate to diagnose a condition. For prognosis, is used to determine the clinical cause of a condition. So the two top ones, the treatment intervention and the diagnosis assessment, you mostly see those used in a DNP program. Causation, etiology, and harm. This is used to determine the greatest risk factor or cause of a condition. And meaning or progress. This is used to determine the meaning of an experience for an individual group or a community. So the two examples that we're going to look at today for this video is treatment/intervention, diagnosis/assessment. So the first bullet is one without the comparison at the time. And again, please refer to your rubric, because if you're in a DNP program, they're going to, most often than not, they're going to want you to have a comparison and a time. And most of the time, they do have an example of what your PICOT question should look like. So let's look at this example. In adult patients with type 2 diabetes, that's my P, what is the effect of using ADA self-care management tool, which is the American Diabetes Association self-care management tool? That is my intervention on decreasing blood glucose. That's the outcome. All right, so it doesn't have any time and it doesn't have any comparison. So let's look at one with the comparison. In adult patients with type 2 diabetes, what is the effect of using ADA self-care management tool in comparison to current practice on decreasing blood pressure, blood glucose? So whatever practice the organization is used, what are they doing? Are they doing verbal education to the patient? That could be included there instead of current practice. Let's look at one that has the time and the comparison included. In adult patients with type 2 diabetes, what is the effect of using ADA self-care management tool in comparison to current practice on decreasing blood glucose in 8 weeks? So that's one with both the comparison and the time included. Let's look at an example, 2 examples for diagnosis/assessment kind of PICOT question. For example 1, for adult patients, does the PHQ-9 yield an accurate assessment information about depression? If you notice, this doesn't have any comparison and it doesn't have any time frame. Look at example 2. For adult patient, does HPQ-9 yield an accurate assessment information compared to BDI? So this is how you can compare 2 tools that is supposed to assess depression. So this is a diagnosis and assessment format for the PICOT question. So I hope this video was helpful. And again, you must or you should make sure that you do your research first before you go ahead and write your PICOT question. Because you don't want to write a PICOT question and then when you go and look at the facility, they're not having that problem. So it's like you're saying an organization is having problem with nursing retention, or so you think. And you formulate, because you're a nurse educator, and you formulate a question about PICOT, about nursing retention. And then when you go to implement, you realize that this organization is not having that problem. So you're not going to have any data. So you want to make sure that you do your assessment first before formulating your PICOT question, and that the organization is having the problem that you're planning to do an implementation or to correct the issue that they're having. All right. So again, I hope this video was helpful. Please, if you have any comments or any question, please make them in the comment box below. Thank you so much, and stay tuned for additional videos.